And just to talk about SASA, SASA is an initiative of advocates across different countries. It is led by our partner in population and development, PPDRO, that is based in Uganda. And the technical teams that are leading the advocacy work sits in two countries, that is Nigeria and Kenya. For Kenya, it's led by JAPIGO, and then for Nigeria, it's led by our partner Pathfinder. And our implementation, particularly for this project, which is going to last for 3 years and began last year as we were beginning the process, sits in 5 countries. And the countries where we are doing the implementation is in Ethiopia, Senegal, Cote d'Ivoire, as well as Nigeria. With this implementation, our focus is on maternal health and newborn health. Across these countries, the intention is to realize what are the governments doing so that we could be able to push the agenda forward as a team. We are given a mandate to bring in all the advocates together to push the domestic resource financing within the conversations that the governments are having. The second part of it is to ensure that the commitments that are done by countries and governments are really up to standard and meeting them. One of the commitments we see countries make, we have SDGs, which is coming to a close in the next 5 years, but we are not even there yet. So the intention of advocates is to ensure that we speak and push the agenda internally. The other part of our intention is to bring both locally led organizations as well as the international organizations to really push the agenda forward so that we don't have duplication of resources, as well as we reach to the areas that are having unmet need for services. When I say unmet need for services, we don't have equality distribution across countries. There are geographies within particular countries are having very low uptake, for example, of contraceptive services, or high burden in terms of teenage pregnancy, child death, maternal death, which are the critical issues that we are really trying to make sure that this organization, or rather this project, is going to help us move forward. So why we are here and why it is important for us to have all the organizations represented here, including the government, is because we want to have one voice. If we speak about the numbers that are low, these numbers are supposed to be pushed by all of us, so that by the time we are completing the process of 3 years, we can come back and ask ourselves, what have we not done right,